Hello, I'm Dr. Jeffrey Kyle.
And I'm Dr. Alvaro Raimunde.
And we're from PAC Pediatrics. And today, let's talk about some normal things and some pathologic things that you find in children's mouths that are over age 1. We already have one video for children less than 1, so you can check that out. And like and subscribe to our channel if you have time. Comments down below, because we'd like to hear what you think of the videos. So if we could get right into some things that we see in kids' mouths that oftentimes can cause a little bit of panic but it can be normal. Mm-hmm. So one of those is a tongue that looks really patchy, almost like islands on the tongue, right?
Mm-hmm. That tend to move, right?
Yes.
It's very mysterious.
And we call that geographic tongue.
Yeah.
What is it? I mean, what happens that causes this?
That is a mystery, believe it or not.
Okay.
No one
Mythbusters
knows.
here, yeah.
No one seems to know. And like you said, it can change. It can vary. You can't spread it from one person to the next. And it is just a variation of normal.
Sometimes there's some patients that may feel a little sensitive to that, to spicy foods, to acidic foods, things like that. So I would generally, if the patient comes in and the parent says, oh, his tongue's been bothering him, I look at it, it looks like that benign, geographic tongue, maybe you should have, they eat spicy Takis all the time. Or and I'm like, well, let's avoid those and see if it helps. And then usually it does, making sure that, tongue cleanliness as well. We're brushing that tongue. It becomes less apparent.
Mm-hmm. Are they, and I don't know, but are kids with geographic tongues, are they more likely to have larger papilla at all? As far as you know, or not really?
No, I think maybe it may stand out as more prominent, kind of almost like that optical illusion. If you've got sort of this white ring that's kind of highlighting some areas and you're really looking at that tongue. For us who are looking at tongues all the time, everyone has just different variations in that anatomy. So I would say for the most part, maybe it's just more of like you're kind of hyper focused on that area and would appear more so.
Cool. So completely normal, nothing to worry about.
Nothing to worry about.
Perfect. What else happens in the kids after a year old? I've received dental reports where, it's like, oh, baby was found with an eruption cyst. What is this? It sounds very scary.
So the eruption cyst is, do not panic.
Okay.
The eruption cyst occurs usually in the area of like the first molar. So around 1 year old, the child starts to cut those first molars in the back. They tend to create this little mound on the ridge. And what that will do is accumulate, some fluid within it. It's called cystic fluid. But as that tooth erupts, it bursts and everything's normal. You might see some blood. It might be a little red. And why it's that bluish, purplish hue is from the trauma. So these kids are they're still eating. Mm-hmm. They're still chewing. And so they keep hitting it and creating almost a hematoma in that area. But completely normal, typically resolves on its own.
Don't pop it.
Do not pop it.
Right.
Another thing is
leave it be.
Does it tend to be painful at all?
It in the sense of teething is painful.
Okay.
So kind of think about like a blister on your heel or something like that when it's fluid filled.
Gotcha.
So stand alone, it's not going to be normal, but you start biting or chewing on things. But in that same sort of way, just that comfort of gnawing on it, that sort of pain pleasure is where those kids start putting stuff in their mouth and start chewing and trying to ultimately, your body's trying to kind of get rid of its that extra fluid there.
And you mentioned hematomas. Is that a thing? Can we have hematomas in our gums and mouth?
Yeah, so you can have an eruption hematoma. Once it does fill up with enough blood or, that's what it's basically a cyst turned hematoma.
Oh.
And how do you tell the difference between that and a dental abscess? Because sometimes parents will, they come in because they see something bulging there and it's like, gosh, is this an abscess or not?
Right. So dental abscesses are usually correlated to teeth that have already, come in. But at the same time, it could be so large that that tooth looks like it's erupting, right? But a dental abscess typically is on the outside of the ridge of the tooth, inside the cheek, on the top and on the bottom. You could see a little pimple there almost in the earlier stages, and then towards the end, it might have a little hole in it because it starts to drain. So that is something. Also, a tooth that has a hole in it, a brown hole, a black hole, or a blue hole if we've been eating food and it's gotten stuck in there. So those are definitely reasons. Now, an abscess is something you have pain, you have a child who's up all night, a child who can't chew on that side, a throbbing pain that nothing's really solving.
A lot different than that hematoma.
Right.
Which is not that.
Absolutely.
Right. And do you treat those most of the with is it surgical typically the drainage, the abscess, or pulling the tooth? Do you have to do that all the time? Is it most of the time, or can you just treat through with antibiotics? Like, what's the
Right. So with dental abscesses, the source of the infection is the tooth. So an antibiotic isn't going to solve the problem. A lot of parents think, oh, I'll take an antibiotic and that's going to make it better. Well, the problem is the tooth, so we have to take care of the tooth. There are different ways to treat infections of the teeth. Typically with our baby teeth or our primary teeth, we are not going to do the extensive work to get that tooth to the point where it is stable enough, long-term stability, like you would be looking with an adult tooth, which would be a root canal. So we actually don't do root canals on baby teeth. Reason being is because we want those roots to dissolve. And so therefore, we don't want to go into those roots. So if you can't clean out the roots, that's where that abscess is coming out of, through the base of that root. Ultimately, at the end of the day, that tooth got to go. If it's an adult tooth, however, there are things that you can do to salvage that tooth. The prognosis is going to vary depending on the age of the patient and how long-standing the infection has been. But it's always worth a shot to try to save that tooth if we can.
Yeah, so it's very similar to an abscess anywhere else on the body. You can't just treat it with antibiotics. You need to actually get in there.
Yes. Get to the root of the infection.
Literally,
And would you guys say that dental caries are one of the most common, if not the most common, cause of dental abscesses in kids?
I would say that's the most common. Yes. The second most common would be trauma.
And if you want to know how to prevent dental caries, watch our very first video of this series on dental hygiene. And we got into this topic because we were talking about swelling and like fluid-filled things in our gums and our mouths. What else can we have in our mouth that can be seen as like a swelling, that could be, different colors, darker colors and things like that?
Like ranulas, right? I mean, mucoceles.
Right.
Mucoceles and ranulas. Yeah, absolutely. Ranulas are typically seen under the tongue. So it's a swelling underneath the tongue. It's accumulation of salivary fluid almost. We also, you have minor salivary glands on your lip, and that's usually where you see those mucoceles resulting from trauma. You bit your lip, and then something that comes and goes. So this mucoceles tend to fill up with saliva, and then they drain and they go away. And then like every cup, there's no set time, but every 30 days you get this,
They're like balloons.
Right.
Very thin.
Yes.
Round,
yeah. So, I mean, some of them do require removal. Others resolve on their own spontaneously. So it is something that if you do see something like that, I really urge our parents and our patients to take a picture of it and then document it. And so you have photographic evidence. That way you know how long it stays. Does it come back? Does it change sizes? Things like that.
And don't pop it.
And don't pop it.
And I think that is a good rule of thumb just to carry across the board, is if there's ever any lesion inside your child's mouth, to snap a picture of it. I know it can be difficult at times, but those lesions can resolve quickly. So by the time you've come to your pediatrician, or by the time you've come to the dentist, that may have resolved, and you go home and guess what? A week later, you see the same thing or it's another area. So it's always great to take pictures. And I'm sure you guys talk about doing that in other ways. Skin lesions, you know, we talk about swellings of the face. We always like to capture that photographic evidence is super helpful because these are things that can change day to day.
Great. So we were talking a little bit about abscesses and we mentioned cavities. What about infections of the gum, like gingivitis? Is that common? Like, what's the deal with that?
Gingivitis is definitely common, especially in, you know, our younger patients we have a tough time brushing. We have a tough time flossing. So bleeding of the gums is normal to an extent. You know, you don't want to stop the brushing once you see that blood. You want to continue the brushing. It's the gingivitis basically is telling you that the gums are unhealthy and they want to be cleaned.
Yeah, and I would say that the number is like 90%.
Yeah,
patients have gingivitis, so it is very common, and it is very easy to resolve. So when you do see bleeding when brushing, you want to not pull back, but brush better, and within a couple of days, it will be resolved. It will just, you know, it's something that's naturally occurring within your mouth. So it's a constant battle to keep that gingivitis at bay.
What's the next step though if your gingivitis doesn't get better? You know, if you don't do your flossing and brushing appropriately, what happens with gingivitis? What can it lead to?
Well, so you're looking at inflammation, and what can inflammation lead to? A whole host of systemic issues and concerns. Our primary focus is on the health of the tooth. So, and we get this all the time. Well, not all the time, but some kids are just super lucky. They have great genes and they are not brushing their teeth, and they come in, it's like, I haven't brushed in a week or 2 weeks sometimes. I haven't brushed since I came here last. There's no cavities to report. And it's just, so then we have to get on to educating that the reason that often people are losing teeth are not because of cavities. They're losing their teeth because of bone loss, and that bone loss is a result of that chronic inflammation, and which then leads to chronic inflammation affecting your whole system. So that, again, probably could be a whole other conversation to be had. So we typically are not going to be treating that early bone loss, and that will be more something that happens later in life that they'll see as a result of it.
And how about, I guess the other thing that we see commonly in the mouth is ulcers that occur, you know, on the gums and in the mouth and
on the lips.
So some there's multiple categories of these ulcers. A lot of them are traumatic. They're traumatic ulcers. They are, you were brushing your you were brushing your teeth and your toothbrush slipped and you jabbed yourself in the vestibule, and now you have an ulcer up there. Something that should resolve itself within 7 to 10 days. You know, within 2 weeks, that area, the mouth will heal itself, turn over. We also have a lot of ulcers that can be associated with the herpes simplex virus. The primary presentation of that herpes virus in the mouth is a very, very painful condition called primary herpetic gingivostomatitis. I know it's a mouthful, but what that is, it's a lesion. But what that is, it's lesions all over. It's on the buccal mucosa. It's on the lips, the tongue. It's very, very painful, and it's a virus. So there's really, as we all know, there's not much you can do besides keep this baby hydrated and make sure that they're eating, you know, bland foods. They're not trying to aggravate things. Over-the-counter pain medications, things like that, to just help with that palliative treatment. But if you've seen this before, you can, it's a testament to like the inflammation. The gums are fiery red and ulcers all over, and you just feel so sorry.
And for the viewers that may not know this is not the same herpes that is a sexually transmitted disease. Your kid or baby has not been doing things they should not be doing. But as far as the ulcers, can you tell the difference between an HSV sore versus like a trauma sore or a sore caused by like drinking or eating pizza that was too hot or something?
I mean, typically you're going to find those herpetic lesions in clusters.
Mhm.
So you're going to, or a hand, foot, mouth is another viral infection.
Mhm.
You can often see the mouth sores. So as soon as I see mouth sores and they're kind of throughout, I'll look at their fingers. I'll make them take their socks off.
Mhm.
You know, the
Mhm.
differentials. So ultimately, more of those traumas, more of a localized, and you're gonna
Single.
yeah,
Here,
yeah,
here, and there's
yeah.
more common where like locations where you would see it. So right at the vestibule, right where that cheek meets your gums, is usually where you'll see a traumatic ulcer.
Perfect.
Yeah.
Great. Yeah, that was a great topic.
Yeah.
Well, hopefully everyone enjoyed this video. I want to thank Dr. Christina and Dr. Katie for coming with us and doing several videos with us today.
Thank you.
And
I would like you guys to leave some comments below on what other videos you guys want to listen to or see, whether it's dental related or pediatrics related. We'd be happy to get some suggestions.
and thanks for viewing our Let's Talk About series.
Absolutely.
Great.
Don't forget to like and share. Thank you.
Bye.
Yay.
Great.